chiropractor, certified acupuncturist, and nutritionist. He lives in Dallas with his wife and 8 children, and he set up 2 healing centers across the states, treating thousands of people. He is a tireless researcher seeking to weed out deception in health and medicine and provide truth and healing where institutional medicinal systems fall short. Welcome, Dr. Bryan Ardis. Lovely to have you here.
Well, I'm so excited to be here, and I hope your audiences are just as thrilled as I am to spend time with you.
Amazing. So today I really want to talk to you particularly about salt. There's a lot of chat at the moment across social media about salt, and it's as if the narrative feels like it's really changing right now. And I've read some very interesting stuff that you've said on salt, so I really want to get into that. So my first question about it all, I guess, is how did we get to where we are today with the narrative on salt being so bad for us?
Yeah, I think the number one thing I want people to recognize is about 4 years ago, I decided, you know what, I'm just going to let the whole world know every single lie I can think of in medicine. And the number one lie I actually talked about and produced my very first organic show on for the Dr. Ardis show was salt is bad for you, was the number one lie medical doctors tell you. I mean, that's number one. Now, the reason why this has been so profound in our belief systems now, truly, I mean, if you ask anybody, is salt good or bad for you? Everybody will say bad for you. And the thing is, they've all been told by media, by their medical professionals, by every health authority on the earth, that salt is bad for you. And if you eat more salt than you should, then you're going to develop strokes. It's a risk factor for heart attacks. You're going to increase your blood pressure, which of course makes all those disease factors all more real and possible. So you have had a pummeling and a repeated lie over and over and over by everybody in unison. The pharmaceutical industry, the medical journals and scientific journals, your medical doctors, all newscasts, radio announcements, everybody, magazines, they're constantly pummeling you. And then you get to processed foods. They even have ribbons across cereals that say low sodium food. They want you to believe that saltless food is better for you than consuming salt. And this has been no different than the propaganda that Dr. Joseph Goebbels in Nazi Germany said. He said, as the father of propaganda, he says, and I quote, "Tell a lie loud enough and repeat it often, and people will start to believe it." Well, they've been repeating the lie that salt is bad for you for decades. In fact, my entire life and probably your entire life. So as we hear this lie repeated, we often gravitate to believe it. And so what it takes is individuals with an open mind to actually ask the question, is the statement being made in the real world, is it true or not? Is it true or is it false? Am I being lied to or is this true? Well, if you have followed anything that I've done, when I get to salt, which I've had a big problem with for a long time. Do you know what my problem was with salt? As every medical doctor, cardiologist, as Cheerios was putting it on the front of their cereal boxes, low sodium food, lowers cholesterol because you're eating cardboard and it's not even food. I mean, when you see these lies over and over and over in your face, I always want to know, well, is that true or is that false? Now, I also like to observe life. Watch life and go, you know what? The medical doctors are telling me that salt's bad for me, but what are they doing with salt?
Okay.
And all I had to do is ask myself that. Well, did they do anything with salt? Why would I ever question their narrative that salt's bad for you? You know, it's shocking. All you got to do is close your eyes and actually remember every time you looked at anybody in a hospital room, in a hospital bed, all of them in unison only have one thing being pumped into their veins the entire time they're in the medical building.
Wow. Yeah.
All of them have an IV stand pumping saline, they call it, inside your veins of your loved one or yourself the whole time you're under surgery, the whole time you're in an ambulance going to the hospital.
To save their life. Yeah.
Every day that you're in there, they are pumping saline inside your body. And then I'll ask you, what is saline? What is it?
Salt.
It is salt water. All right. So the moment you're let's just say you have a heart attack. I'm telling you, they say nonstop that salt's bad for you, and salt increases your risk to develop high blood pressure, which then will become a risk factor for strokes and heart attacks. But
Okay,
if
so can
you,
I stop you quickly? Can I stop you quickly? Why?
sure.
Okay, well, just pause you because this is way too interesting, all of this. Okay, so why in the first place have we been pummeled with this information? Now, we have very different medical systems in our two countries, seemingly, in the US and the UK.
Sure.
But this propaganda, as you call it, has been widespread worldwide, right? So
Oh, yeah.
what is at the root of that?
Yeah. So you ready to know what it is? If you want
Go
to know
on.
what's the root of that? In 2016, this is all you need to know, actually. In 2016, Tel Aviv University in Israel conducted a study, 500,000 patients in 49 countries. It was the largest study ever done on high blood pressure. And they found 49 countries, 500,000 people, that the individuals who consumed the most salt every single day had the best blood pressure readings and the most normal blood pressure readings. And all the individuals who consumed 3 times the amount the FDA tells you you should consume salt every day, every person around the world that consumed 3 times that amount had better blood pressure readings than anybody
Okay.
who took the FDA readings. Now, they publish in the Lancet in the UK where you are. The
Mm.
Lancet is a medical journal. They publish the results of the study that the more salt someone consumes, the better their blood pressure is, and the lower their risk factors for stroke and heart attack become. When you just asked me why and who benefits from this lie, why would they tell us this lie? Did you see that when that was published by the Lancet, did you see who threatened the Lancet with pulling their funding if they publish that study and don't retract it?
No.
The American Heart Association threatened the Lancet and told them, you publish that study, we're going to pull all of your funding. You have to retract that study. All right. So the next question for you is, why would the American Heart Association be angry at a medical journal for publishing a study,
Right.
largest one ever done in history, proving that salt intake, the more salt you eat, the lower your risk factor for high blood pressure, strokes, and heart attacks is? Why is that a threat to the American Heart Association? Which, by the way, is the highest revenuing medical association in the whole world.
What?
Why would the American Heart Association threaten the actual medical journal with their publishing of that study if they don't retract it? What's the threat to the American Heart Association if that truth was to get out?
Tell me.
The American Heart Association's 90% of all their funding comes from the pharmaceutical industry, the
Right.
drug makers of high blood pressure drugs and stroke drugs and heart attack drugs. So if the majority of their funding comes to them from high blood pressure drug manufacturers like Merck, Pfizer, and others, of course they're going to see this journal as a threat and this article as a threat, because if people started eating more salt in their diet and they read that study and medical doctors got a hold of that information and that truth, they would start telling their patients to eat more salt. Well, does Pfizer own salt companies? Not that I'm aware of. Does Merck own salt companies? Not that I'm aware of. But even if they did, salt is cheap and it's a natural resource that you can't patent typically unless you change its formula. So this was the ultimate threat to the American Heart Association is it will reduce sales in high blood pressure medications, stroke medications, and heart disease medications. If the truth gets out that salt in increased amounts than what the governments are telling us will reduce our risk of heart attacks and strokes. So who did the lie benefit the most to tell all of society that salt is bad for you and lower your salt intake? Who did it benefit from the
Right.
beginning?
Terrifying. The
It's
pharmaceutical
the drug companies.
Yeah.
The drug companies that make the high blood pressure drugs. Okay, so this is no different, and we're not going to stick on this topic. But in order to convince people that fat was bad for them,
Right.
the drug companies had to lie to medical doctors and in scientific journals and tell them all that when human beings swallow anything with fat in it, their liver will convert that fat into cholesterol And we have found that cholesterol, as it builds up in your blood, increases the risk of plaque, blood clots, strokes, high blood pressure, and heart disease. Now, who was telling the medical doctors this? Oh, it just happened to be the same drug companies that just created a drug called statins that they figured out in animal studies lowers the amount of cholesterol the liver can make. Okay, this is fun. So once they figured out they had a chemical that actually did in every single mammal they put it inside of it, lowered this thing called cholesterol, then the drug companies had to come up with a way to convince all the medical doctors to promote their drug that lowers cholesterol. Well, what's the best way to sell it to them? Tell them that the number one cause of death around the world typically, which is heart disease, is increased in risk by increased cholesterol. And so if you just tell the medical doctors that lie, they go like this: oh, sweet. So do you have a drug for that? Good. Let me promote it. And will you give me incentives? And will you give me commissions and royalties? And yes, then all the medical doctors will tell you the same damn lie, and they'll never look into it. And the truth is, all along, I mean, how many of you have watched people doing keto diets and carnivore diets and just shredding weight? They lose weight, they're reversing diabetes, and this is them consuming protein and fat, increasing their cholesterol, increasing their fat intake. But what have we been told, especially throughout America, and I'm sure in the UK, what have we been told for 50 years? A low-fat diet is good for you. This whole thing is a lie. We have to reduce the amount of fat people consume to lower their cholesterol. And what has happened ever since? The more cholesterol drugs we sell, the lower the cholesterol levels go in this country and around the world, the higher the incidence of strokes and heart attacks become. And in every single year, those numbers have gone up. That we've actually been listening to this lie and swallowing the pills. It's ridiculous. Well, let me just tell you the narrative here. Now, we're going to use this example and put it with salt. Okay, we're being lied to about salt. We're being lied to about fats that equal cholesterol. Okay, if you tell people that they have to lower their cholesterol and we have a pill to do it and it will protect you from having heart disease, which everyone's being told this is hereditary and there's nothing you can do to avoid it but take our drugs. That's the other lie. So now you're scared to death that you can't control it because your mom or dad or aunt somewhere had heart disease at one point. You're going to have it. Your medical doctor's telling you, unless you take this drug. You start taking that drug. What you guys don't know is that the moment you start taking the statin drug itself lowers the amount of cholesterol your body can make no matter how much fat you're consuming. Right. And did you know at home, everybody, that cholesterol is the backbone required by your hormone glands in your body to make most of your hormones? I mean, you need cholesterol to make testosterone, men. Guess what happens to most men when they start taking a statin drug? They can't have an erection, and they have no sex ambition or drive. Well, where did that go? I mean, 6 months later, you're going to go to your medical doctor and tell them, look, doc, I'm glad my cholesterol numbers are better, but I just have no interest in sleeping with my wife. I can't even get it up. And guess what the MD says? Oh, that's okay. You're in your 40s. This is normal for your age. It's called erectile dysfunction. Here is a little blue pill to help you with that. When in fact, the cholesterol drug you started 6 months ago doesn't allow your body to now make testosterone because you need cholesterol to make testosterone. And testosterone drives sex drive. It also increases blood flow. So now you can have an erection. So because they lied to you initially and said fat is bad for you, causes cholesterol to go up, which will cause you to have heart disease and increase your risk of that, take this pill. You take that pill. Now you lower your amount of cholesterol. All the side effects after that are this. Men will no longer have any sex drive, can't get an erection. Now they're going to go on Viagra, which is a drug to offset the side effects of the statin drug and the low-fat diet that you're now on. Okay, that's one. Did you know serotonin, the hormone in every male and female's body, needs cholesterol to be made?
Right.
Okay, well, what does serotonin do to humans? It makes you feel happy.
Yeah.
And it makes you feel safe. So there's no anxiety or panic. Oh, really? All right. So now you can't make serotonin. Serotonin is your happy, feel-good hormone. Now you can't make it because you don't have cholesterol to make enough of it. What are you going to report to your medical doctor within 6 months to a year after starting your statin drug?
Right.
You're going to tell them you're depressed, you're anxious, and guess what your MD is going to tell you? That's okay. This is normal. A lot of people experience this. A lot of people in my practice have this after 6 months of coming in here and getting their cholesterol checked. We put them on this drug. And now you can actually have another drug to offset the side effects of the cholesterol drug and the low-fat diet. And they can sell you more antidepressants than any other drug on the planet. And that is exactly what's happening and